You've lived a great life and done well for yourself. But what mark will you leave on the world? How will you inspire future generations? Stan Miller and Katie Beth Hand have helped thousands of people answer exactly those questions. If you've ever wondered, what will be my legacy? You're in the right place. Welcome to the Your Life, Your Legacy podcast. Now, here are your hosts, Stan and Katie Beth.
I'm Stan Miller. I'm the founder of the Legacy Leaders Network. I'm an estate planning attorney, a CEO of Pinnacle Legacy Law here in Little Rock, Arkansas. And I'm really thrilled, honored really, to have guests here in our office, here in our studio from all around the United States. We have some real thought leaders in the medical research space. My colleague Olin Wiley from Atlanta, not a doctor, right, but a financial professional who plays just an incredible role in the success of what we're doing here, and Dr. James Gavin. So all of us are involved in a really, I think, creative and interesting way in the AMOS Institute. And so what I would like to do is to have you, Dr. Gavin, I want to get into the AMOS Institute and how it got formed, but before we do that, I want to have our audience hear a little bit about you and your background. Now, I know I've read your bio. I read it to my wife, and it actually took about 15 minutes to go through all that. You've done a lot of pretty cool stuff out there, but I think that to have this audience really appreciate the story that we're telling today, they need to have a sense about who you are and your role in really being a really key player in bringing the AMOS Institute into being.
Well, thank you so much, Stan. First and foremost, let me thank you for the opportunity to be your guest here at Pinnacle and to be a part of the Legacy Leaders process, because it really means a lot. What most people don't realize is the extent to which what we are doing here, how that represents the kind of partnership that is really ideally suited to meet the lofty goals of what it is we set out to do more than 44 years ago. Wow. When we started in this initiative, which started out basically in response to an earlier kind of problem. The earlier problem that led to the formation of what was initially the Harold Amos Medical Faculty Development Program. It started out in response to a program that was trying to get more medical students to expand the healthcare workforce, to better represent the demography of this country. And the Robert Wood Johnson Foundation was really trying to get to a point where we had representative numbers in the medical and healthcare workforce. But we set up a program that was really successful in increasing the numbers of students who were interested and trying to get into medical schools. That was the target initially. But we weren't getting the numbers in that would have been commensurate with the number of people that were showing up to participate in our program. And it turns out that the reason they weren't getting in is because medical school admissions were largely governed by people who sat on medical school admissions committees. And those were faculty people. And we had even fewer people at that level than we did at the student level. So to fast forward, to their credit, the Robert Wood Johnson Foundation trustees said, well, if that's the problem, well, maybe what we need to do is to work on the core of the problem. And so they allowed us to form a second program, and that was the Faculty Development Program, with the intention of identifying these folks who were well-trained and could actually become faculty members. And that's how we started. Now, they thought that we would get maybe 25, 30 people in that initial round in 1983 of applicants, and so they set up a very small program. We got 135. Wow. And we had to double the size of the program on day one. And it really took off, and over the years it has expanded to where we are now. Now, to take a step back, I would give you the Cliff Notes version of my background, because you said you read it.
I think it's important, the story.
And you know, I'm born and raised in Mobile, Alabama, a product of course, segregated school systems from Alabama, and went off to college in North Carolina, and decided that I wanted to become a bench scientist. So I actually did a PhD after graduating from a little small college in North Carolina, and went to Emory, did my PhD, and then did a postdoc at the National Institutes of Health. All of these things actually came back around to actually help me understand what it was we needed to do in programs like this later in life. But while at the NIH, working as a hormone chemist, I discovered some really interesting things about a hormone called insulin, which I had never worked on. I had no knowledge of it. This was in 1971. My mentor at that time introduced me to it. Well, in learning about insulin, I learned about a disease called diabetes. Turns out that was the disease that killed my great-grandmother, who was beloved in my family. And it turns out that is the disease that ravages my family. So I made a decision. If I'm going to spend my life doing research, I may as well do it in a disease that's relevant to people that I know and love.
Yeah.
I had to get new tools. So I went back to medical school. I went to Duke, trained as an internist, subsequently became an endocrinologist, and with an interest in diabetes. And the rest, as they say, with respect to diabetes, is history. But it was while I was a young professor working at Washington University in St. Louis that I met Ruby Hearn from the Robert Wood Johnson Foundation, who invited me to come to work with the foundation as an advisor, and that's when we started with the Medical Student Project, and from the Medical Student Project, it evolved into the Harold Amos Faculty Development Program, and that was 44 years ago. I've been involved with that program ever since, and we have evolved in our vision, which is, I guess, one of the things that we want to talk more about here today.
We do. Give us an idea of what kind of footprint the foundation has now around the country.
Well, the Robert Wood Johnson Foundation is still the largest healthcare philanthropy, private healthcare philanthropy in the United States. And at one time, the portfolio of programs in the healthcare field that the Robert Wood Johnson Foundation sponsored was over 3,000. So it's a very large. At the time that I worked with it, it had a corpus, that is, its endowment was in the $10 to $14 billion range. It varied over time, but it has always been a fairly large philanthropy, which was dedicated towards improving the health of the American population.
Yeah, that charity really originally was funded from a healthcare related business, right?
From the Johnson & Johnson industry. It had General Robert Wood Johnson was one of the people who was initially involved, and for the longest time the Robert Wood Johnson Foundation's the major portion of its endowment was invested in Johnson & Johnson stock, but it divested of that and quite still bears the Johnson name, of course, but has had no relationship with the Johnson & Johnson company for most of its history.
But now we've moved out
Yeah.
from under the umbrella
Yes.
of the Robert Wood Johnson Foundation. Talk about that.
Well, you know, I think it's important for people to understand that what the Robert Wood Johnson Foundation did in setting up this program, or helping us to setting or sponsoring it, was visionary. It was historic in terms of what it was trying to do. And remember, they could have just backed out, but they said, you know what, if the problem with getting more medical students is that we need more faculty, let's go after more faculty. And that I have to salute them for and commend them for that kind of vision and courage, really. As a foundation, it doesn't fund anything in perpetuity. And so the fact that they funded us for over 40, well, it's still funding the last group of scholars that are under the old program. The fact that they funded us for that long is really a nod to them. It's a huge nod to them. But the work was so successful, has been so successful, that when their funding stopped, it became very clear that, you know what, we need to continue this work. Because by the time their funding stopped, we were actually already in the evolution of expanding the program to be more than just career success. We were talking about now, how do we make sure that these scholars have life success, which is why we've, come into fellowship and partnership with you. And so the only way to make sure that the work continued at a level and with the kind of quality and taking advantage of all of the experiences that we had garnered over those years, the only way to assure that would be to set up an organization that would preserve that and grow that. And that's how we ended up forming the AMOS Institute for Medical Faculty Development, a not-for-profit which has now the ability to grow without the constraints, quite frankly, that were imposed by being connected with a foundation. And we can get more of the types of people in who represent what's needed on the healthcare team. And that is now our wonderful opportunity. Obviously, our wonderful challenge is how do you sustain it?
But you don't have the safety of that umbrella now.
That's exactly right.
Now we're out on our own, right?
And that's important, because when you turn that corner and you become, if you will, independent, there is a price for independence. It's extremely liberating, because now you have become self-determining. But by the same token, you have to become self-supporting, and that means that we are now in the private sector with clearly with continued access to the public sector, but we now have to really engage the private sector in the importance of what it is we're doing and why we are out here in the fundraising business to make sure that this important work continues. And that's why the kinds of partnerships that we've formed with people like yourself and people like Olin have been so important.
Help me put a face on what kind of dollars it takes to take a cohort from the beginning through the program.
To take a cohort of scholars, our typical cohort has been anywhere from 8 to 16 scholars in any given cohort. And our award level, now this is independent of operating costs for running the program, is usually about $500,000 for each scholar. So if you think about those numbers, that for a cohort, say if you round it up, 15 scholars per cohort, and you need $500,000 per participant, you can easily see why it takes about $7.5 million to take that cohort through.
Through a 4 year.
Well, the 500,000 that's a per year per person.
Oh.
Because this is actually, no, you're correct. It's for the 4 years. So that 500,000 covers them for the 4 years. So that's what it would take to get the cohort through.
And that money funds their salaries, and does it go for other things as well?
Yeah, it goes to, of course, because of who these people are, the kinds of practices and positions that they have, the research programs that they run, we're not able to pay their full salaries. So we supplement, we pay a portion of their salaries. But for that portion that we pay, we make fairly heavy demands, because we actually commit them to a certain percentage of their time for medical research, and that's what really is important. But we also provide funds to support the cost of running their research labs, research technicians, for example, and travel and things like certain continuing education expenses. So those kinds of things are important. And plus we have to provide a little bit in terms of indirect, because they still have to participate in insurance programs and the like.
So what does a person look like who would be in a cohort? What's the background? What kind of education they have? Are they MDs, PhDs?
Yeah. So when we started out, Stan, the program was basically geared towards recruiting MDs who were doing basic research, running basic research labs. And then we evolved so that we started recruiting MDs who were doing basic or clinical research. But then it became very clear that we needed to broaden the umbrella in terms of people that we were getting into the program. Because if you think about who constitutes a medical team, what does a healthcare team look like? Well, it has people who have MDs. It has people who have MDs who are involved in different specialties. It has people who are trained as nurses and who are doing nursing research. It has people who are doing behavioral research, so that they're trained as psychiatrists and psychologists. Dental health is something we don't talk nearly enough about in terms of its contributions to chronic disease. So we had to get dentists involved. You know, these are all things that are important for improving the health and health care of the American public. So we have evolved from a focus on MDs doing basic science research to the point now where we are attracting MDs in virtually every one of the specialties and subspecialties, nursing researchers, dental medicine researchers, and because we now have more independents, PhDs who are doing the important work of behavioral research, epidemiology and epidemiological research, biostatistical research, all of those kinds of components that have always been important. We simply have not had them in our portfolio. But now we will be able to broaden our net to include them. And they are well trained. We have to make sure that those people who are in clinical specialties, we don't start supporting them until they've finished their clinical training. Because what we want them to do is to be ready to springboard into active research activities.
Right. So I love to hear stories. And I know we've been at this a while. We have people out there who've been doing this for a long time. Just share some of the interesting outcomes that these cohorts have. I'm sure there's some discoveries, some transformative changes that have evolved out of this. I'd like to hear about those.
Well, you know, one of the things that we are most proud of in this program is that in addition to trying to make sure we contributed people who were doing research in all of the areas that are important to the health of the American public. We have people doing hypertension research, we have people doing cancer research, diabetes research, lung disease research, liver disease research, GI, gastrointestinal disease, brain research. We have people that are doing cutting edge research, even in the high-tech fields of imaging research. We have people who are doing absolutely fabulous work in all of those areas. But not only that, but people who are doing health services research, finding out why is it that with all of the resources that we bring to bear to take better care of people in the American public, why don't we have better outcomes for the dollars that we spend? Well, this is called health services research. And to try to get at those answers, in other words, why aren't we more efficient and effective in using the huge numbers of dollars that we have? It takes research to really ask the right questions and then bring those answers to bear on changing systems in a way that you actually can get communities engaged in their own health. And we've seen plenty of those kinds of outcomes. So what we had not anticipated was the extent to which we would be generating leaders in these fields, because it's important to have people who are doing the cutting edge research, but what you really want are people who are going to be leaders in the field, because these are the people who set the dynamics for what policy changes do we need, what changes in the workforce do we need in order to make the delivery of the health care that we are concerned about more equitable, more broad-based, so that it reaches rural communities, so that it reaches underserved communities. These are the kinds of leaders that we are actually recruiting. And we have incorporated that, we have embedded that in what we do. We do leadership training so that people will be able to do things like we have At one point, we had 3 of our alums from this program who were directors of categorical institutes at the National Institutes of Health. That is, these were people who were leaders of places like the National Heart, Lung, Blood Institute, the National Institutes of Diabetes and Digestive and Kidney Disease, and the leader of the Bioimaging Institute at the NIH. These are all multi-billion-dollar installations that fund research nationally. And those are the people now, the people come from our program, the representative of not only the quality of research that they did that earned them those positions, but they now become people who are governing the priorities and the setting the strategies that are going to be used in hundreds and hundreds of research programs throughout. One of our scholars became the editor-in-chief of the publication network of the American Medical Association, JAMA. We call that the Journal of the American Medical Association. Sure. And it's a, as you know, it's a huge network, publications that provide education, provide information to organizations and to institutions and to individuals. One of our scholars, and it goes right on down the line, presidents, deans, chairs of departments, leaders of industry programs. This is hospital leaders. The president of Sloan Kettering right now is one of our alums. The dean at the, I work closely with the University of Miami in the state of Florida. Turns out that one of the people who applied to our program is now the dean of the School of Medicine at the University of Miami. But the stories like that are absolutely, they're fabulous. We're really proud of them, but we are only just beginning. We're only just scratching the surface.
So I want to follow up on a comment you made earlier in this conversation about not just doing medical research and funding leadership training, but impacting the quality of lives of the people that are involved here. Would you speak to that for a minute? Because I know that you have a point of view about that, where I think there, and you can share that. But as I understand it, you are fairly convinced that we have a community here that may be a bit behind the curve on financial planning, estate planning. Maybe they haven't done as much in that space as other people have. And I know that's the conversation we've had a number of times, but I'd like for you to speak to that.
Well, you know, Stan, I have felt for a long time that my own life in many ways is a bit of a template for things that are possible and things that need to be improved upon. And one of those areas is in the area of what I call life success, not just career success. So we've talked about how many of our scholars have achieved leadership roles and are driving important programs. But one of the things that I found out, and I've had many conversations about this with Olin over the years, is that nobody takes people like me, you know, as a person coming up through the ranks of research training and medical research training, and talks to you about how do you gain financial literacy? How do you gain the kind of financial independence so that you can actually think about retiring in a way that will take care of your needs and your family's needs, but more than that, as I've said to our scholars over the years, you know what? I want you to do more than just be the people asking folks to fund and endow your laboratories. I want you to be one of them, right. One of those people who can. Well, you know what? There's a pathway to that. But we were simply not on it. And so I moved from an emphasis on career success to talking within our program about, let's expand this to life success. Life success means, yes, you have career success, but you also have the ability at the end of the day to make decisions like, I want to fund your professorship. I want to fund your laboratory. And the only way you can do that is to have done the planning and made the kinds of investments that are required to do that. And that required a whole new skill set. And we weren't getting it. And shame on us if people like we were recruiting into our program still didn't have it by the time they came through our program and were going out into the world to be great leaders. And so the only way we could be sure of that we were putting the right emphasis on life success to be aligned with career success, is to start making it available. And so now here we are. We have the kinds of partners, we've created the kind of consortium that I'm extremely excited about, because what it means is that if you do life success correctly, you not only enhance the financial well-being of the individual scholars, but you also enhance the financial well-being of the places where they work, where they train, and you enhance the well-being of organizations like the Institute itself that is out there doing the hard work of trying to make sure that these scholars are funded and productive.
Can you talk a little bit about going forward, how we fund this?
So the way we are looking at funding this has to be multi-pronged, because as you know, the numbers that I just cited, we're talking about a multi-million-dollar enterprise on an annual basis. Okay? And so clearly we're going to have to look for sustainable sources of funds. So we're going to be looking for endowment. You look for endowment through a variety of ways. You look for it in the private sector, for people who share your belief in the importance of the programs that you're trying to promote. We are going to places like foundations. We're going to places like private industry. Remember, we generate people who end up making contributions that can be taken by industry and harvested for the generation of products and services that can be profit-bearing in the long term. We go to individuals. You know, even our scholars, our alums, are in our donor pool. So, and of course, we are opportunistic to the point where if there are public sources of support that we can gain access to that would be commensurate with our goals and our priorities, we go for those. So we're talking about a multi-pronged strategy. People that are listening to your podcast, those are going to be people that will hear from us, because we need their embrace, we need their support.
You know, people really do want to make an impact. They really do want to make a difference. We just have to connect the dots so that they can see how to do that.
Yes, and we have ample opportunities. We have opportunities for people to endow portions of the program. We have opportunities for people to become members of giving societies that we will have as part of our structure. And of course, that will come with what we hope will be an attractive set of perks. And those are perks that are largely going to be centered around the intellectual. But I think it's going to be something that people can take great satisfaction in being a part of.
Well, I'm looking forward to being a part of it.
Well, you are already a part. Your option is gone.
Absolutely, absolutely. In fact, I admit we wouldn't be here had I not met you a couple of years ago. Dr. Gavin I met in 2002 when he became president of Morehouse School of Medicine. And the HR director called me and said, we got a new president coming in. You need to put a package together and come and talk to him. And I went and met him, and in my first meeting, I knew this was a guy that I was going to like. I didn't know that I was going to grow to love him. God gave him a compassionate heart. We're talking about life success for these doctors, but let me tell you who he was a hero to on the Morehouse School of Medicine campus. It was the assistants and those who were not in the C-suite. He just became their hero. Why? Because he genuinely cared for them. He wanted them to be better. He wanted them to do better, and they could feel it. To this day, if I walked on the Morehouse School of Medicine campus today, which I still do 4 or 5 times a year, first thing they're going to ask me about this going back to 2002. And so our relationship evolved from a professional standpoint, but also from a friendship standpoint. And back in 2013, he invited me to a dinner that he and Dr. Anna was hosting at his home, and he was having a dinner for the organization. That was my first introduction to him. That same care he had for those individuals was the care he had for these alums and scholars. I said he had 400 or 500 grandchildren, because that's the way he treated them. I mean, seriously, that's just a simpler way he treated. But that's
They couldn't just be children?
children, grandchildren, and whatever the case may be. But it's time, and I, at that time, I'd been working with docs for 20, 25 years. But they were different. They were the kind of docs we grew up, we were running this practice and whatever the case may be. So as time rolled forward, I attended the first annual conference in 2022 in Washington, D.C. And I went there to try to step up and help Doc fulfill this Life Success Initiative, and I was introduced to a group of people who had a whole different set of kind of problems that I was used to solving, And all of a sudden, you're looking in your toolkit, and you said, the more you talk to, the more you say, man, I don't have the right wrench in here for this, and what have you. It was the very next year that our mutual friend Jerry Robinson introduced me to you, and the Legacy Leaders Network, and I read your book, and what have you. And that got the wheels turning. It began to point out to me the exact tools that we needed, the partnerships that I needed, and that was the birth of our partnership. In fact, the consortium of professional providers, you and I came up with that name and started it ourselves as a strategic partnership between Legacy Leaders and at that time the consortium of wealth. That brought us to the point that where we are now, that I'm extremely excited of what we're able to do, not only for the scholars and alums, but for the employers, association partners, because I look at this as a whole community. To me, this is the new face of research. And I know that they're capable of doing that. And so we're excited. And I think as people learn more about them and the leaders and the staff that's involved, and again, those alums and scholars that are out there are just doing marvelous things, I believe that we will have the kind of supporters that we need, that research will still have the kind of future it deserves.
And Stan, I have to say that as part of the Life Success Initiative, I think we really moved to a different level when we were able to start incorporating the whole issue of legacy into our discussions, because it pulled everything together in a way that eyes were opened in ways that I think our earlier discussions weren't successful at opening their eyes. And so I think it has really been a huge and meaningful contribution made by having that addition.
I'm very humbled by what you say.
Well, it's absolutely true, and we've gotten lots of feedback from that, because it gives meaning and substance to what they are doing that will drive real success, because that real success not only occurs now, it's after they've gone.
It is.
Okay.
That's right.
Yeah.
So true.
For sure. Good to have you here, guys.
Well,
Good to be
thank
here.
you. Thank
Thanks
you
for
thank you for everything that you're doing and will do.
That's right. And the best is yet to come.
It is, for sure. Yep.
Thanks for listening to the Your Life, Your Legacy podcast with Stan Miller and Katie Beth Hand. If you enjoyed the show, please rate, review, and subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. To find out more about Stan and Katie Beth, go to pinnaclelegacylaw.com. You can also find links in the show notes.